All right, hi. My name is Angelo Lamantia, and this is my final presentation for Child and Family Development 562. First thing I want to go over is the problem at hand. So, the problem is we have a relationship between childhood adversities and dissociation and severe mental illnesses, such as PTSD, personality disorders, bipolar disorder, and other disorders such as schizophrenia. There is a term here that I'd like you to know, which is dissociation or the act of dissociating, and that is, you're going to read it right here, but is the experience of detaching from reality and going into some alternate state where you're basically daydreaming. Okay, so moving on to research article number 1. This article is called Relationship Between Childhood Adversities and Dissociation in Mental Illness. And it's a meta-analytic review from Acta Psychiatrica Scandinavica. And the summary is, I reviewed it and it examined the magnitude and consistency of the relationship between childhood adversity, such as sexual abuse, physical abuse, emotional abuse, neglect, bullying, natural disasters, and mass violence. And it looked at dissociation across 4 diagnostic groups: schizophrenia, bipolar, personality disorders, and PTSD. Here you can see some main terms I'd like you to know. I think it just helps you better understand. So we have PTSD, we have schizophrenia, we have bipolar disorder, and we have personality disorders. So basically, how would I put this? This article shows that dissociation is involved in all aspects of abuse and neglect, and we'll get more into that. So, right here, we have the results, and the results indicated that all types of childhood adversities for which it was possible to extract specific effects were positively associated with dissociation. The true effect may be bigger or smaller than what the current meta-analysis is showing, but here we go. We have all the different types of abuse and neglect on this left-hand column. And then we look over and we see p-value right in the middle. And to have a significant p-value, meaning that the results that you are testing are significant and meaningful and are positively associated, means that the p-value has to be less than 0.05. And if we look at that middle column, almost every single p-value is below 0.05, meaning that dissociation is most likely involved in all traumatic, abusive, and neglectful cases. Except somewhere right in the middle. It's a little bit over on neglect, but yeah. And then we have state versus trade. Okay, this slide. So, number of children that suffer from abuse and neglect in the United States is roughly around 600,000. It's probably more though, just because not everybody's reported on it. But then that means all of these kids, let's say it is 600,000 right on the button. That means that 600,000 kids every year are receiving some form of dissociation, and that might be correlated with PTSD or schizophrenia or bipolar or a personality disorder that might correlate, and they become comorbidities, which means they're acting simultaneously at the same time in your brain. So, slide's called state versus trait. You see, state dissociation is viewed as a transient symptom which lasts for a few minutes or hours from a traumatic event. But trait dissociation is viewed as an integral aspect of personality, which means that is now your personality. So yeah, I'm breaking it down even farther into that. And so I want to say these are two distinct diagnoses. They have different clinical approaches. So my next two articles will present possible solutions to state and trait dissociation. Okay, so we have research article number 2. And state dissociation moderates response to dialectical behavior therapy for post-traumatic stress disorder in women, children with and without borderline personality disorders or personality disorders, including like PTSD, maybe some schizophrenia. But here are the two terms I need you to know. Summary: state dissociation during psychotherapy sessions predicted improvement after dialectical behavior therapy. So state dissociation improved after getting this type of therapy, which would hopefully be a solution to half the problem. It also says that PTSD patients with low state dissociation during treatment had a higher chance to show substantial improvement. This relation consistently emerged across subgroups of PTSD patients with and without personality disorders. The operationalization of dissociation as state versus trait dissociation made a difference as improvement was not significant for trait, meaning that DBT can hopefully solve state dissociation, which is half the problem. Okay, research article number 3, electroconvulsive therapy and successful treatment of rapidly fluctuating psychotic dissociations in a patient with chronic schizophrenia and post-traumatic stress disorder. So we just heard psychotic dissociation and chronic schizophrenia, meaning that it is more trait-based. Summary of this case is case report of a 35-year-old teacher with a history of schizophrenia. She was presented to the emergency department distressed because of 1.5 weeks of progressively worsening psychotic cabgrass delusions that her husband had been replaced by demons. She was described as guarded, fearful, and responding to internal stimuli. He described one previous psychiatric hospitalization for psychosis. So the workup from the ED and hospital admission laboratory revealed no major abnormalities. She received no medication in the ED and was directly admitted to the psychiatric hospital. Considering her historical diagnosis, the presence of delusions, hallucinations, disorganized speech and behavior, no emotional expression, no mania symptoms, the admitting team agreed with schizophrenia as the working diagnosis. Considering the question of severe dissociative symptoms versus dissociative identity disorder, electroconvulsive therapy was initially involved. However, her symptomatic stability rapidly declined with each fluctuation, prompting to start ECT. Over her ECT course, the frequency of her fluctuations gradually decreased, allowing more prolonged intervals of so-called calmness, we'll say. To continue, treatment-resistant PTSD has been shown to have improvement in symptom severity when treated with ECT, particularly associated if you have major depressive disorder, which is right here. Meaning that schizophrenia has a little bit of a harder time, but PTSD and dissociation, trait dissociation, are more successful. Okay, so solution. We can see we have adversities. That last case was about an older woman, but my hopes is that ECT can then be used on children, and that's why I was relating that article. So, solution. We have adversities, we have dissociation, we have state, and we have trait. And it's looking like DBT is a solution for state dissociation, whereas ECT might be the solution for trait. So these articles don't necessarily stop abuse and neglect, but it's sounding like they sure heal individuals from abuse and neglect. Now, I'm not sure how much it would cost, but I would hope somewhere along the lines that these two things might be taken more serious in helping individuals heal. Yeah, and that's pretty much the presentation. Here are my references, DSM, my 3 sources. I used the Mayo Clinic, all great references.